All right, let's go to the story now. The high rate of men who are murdered in the country is a health priority, and a group of researchers conducted this particular study, which is looking at this very disturbing subject. And let's get more details now. Professor Richard Matzopoulos, a South African Medical Research Council Burden of Disease Research Unit. He comes from that unit and is joining us live now to talk about this. Thank you so much for your time, Prof. Give us a sense of the period the research was conducted in, as well as the numbers. Prof, good evening. You are on mute.
My apologies. Sorry. Good evening.
Hi.
This is better now. Okay. This is part of an all-injury mortality study that we conduct every 8 to 10 years to inform our national burden of disease estimates. So we consider in burden of disease studies all of the mortality and morbidity associated with diseases in South Africa before we start considering risk factors that drive those disease burdens. Unfortunately, for injuries, there's extensive misclassification in cause of death statistics, and for this reason we draw a sample of cases from all the forensic pathology services or state mortuaries across the country. In this case, we collected data on more than 30,000 injury deaths from more than 80 mortuaries, which represented nearly 54,000 injury cases in total, and more than a third of those are murders. This is perhaps the largest sample that we've collected. And part of the reason is that we teamed up with researchers conducting a study on female homicides and child murders to pool our resources. But the research that we're talking about is really from the first phase, from the Forensic Pathology Service. We haven't yet released data as part of the second phase, where we look at some of the situational factors associated with male homicide risk, which we've collected from the police. So that's a bit of background to the study. I'm happy to share some statistics.
Yes, please go ahead, because we also want to know in terms of the numbers and how things have been looking over this period.
Okay. So this is the second study for 2017. It takes a while to analyze the data and prepare the outputs, and there was COVID as well, which also affected a delay, as I'm sure you can imagine. But we're comparing these data against 2009. And what we collected were data on men and women. We were interested in the age and provincial distribution of male homicide, as well as some of the high-risk times. And where possible, we compared our statistics against the global averages. And the findings are quite astonishing. So for every woman murdered in South Africa, there are 7 men that are killed. Now, it's not unusual for men to be murdered at a higher rate than women, but it's much higher. The ratio in South Africa is much higher than it is globally, where it's only about 5 to 1. So we're looking at about 7 to 1. So we have a particular problem. We have a problem with female homicide, certainly, but it's even more pronounced with male homicide. South Africa is similar to several other countries with very high murder rates, where murder overwhelmingly impacts on men, but also considerable variation by age and province. So, for example, the highest ratios comparing men against women were amongst young adults, 15 to 44 years, about 8 male deaths for every female. And in the Western Cape, there were an estimated more than 11 male deaths for every female.
And when you were conducting this particular research, how were you finding that these murders occur?
Well, most of them are either stab wounds or gunshot injuries. So we've seen an increase in gunshots over time. You can also see the prominent role of alcohol. So we didn't measure alcohol directly, except for a few cases where deaths were tested. But you can see from the timing of the deaths, very much clustered around December, which is a year-end holiday period, and particularly on weekends, we saw considerable number of deaths compared to other days of the week and other time periods.
Sure.
I think we know from our COVID experience with alcohol bans that as soon as you restrict access to alcohol, that picture changes dramatically.
And, you know, we often talk about gender-based violence from a female perspective most of the time, and the murder rate as well, as well as femicide from a female perspective. But what do these numbers then tell us about the vulnerability of men? Because if we're seeing a ratio of 7-1, sure, that is quite worrying.
Yeah, and look, I think it's right to focus on women to some extent. I mean, it's certainly an epidemic that we need to address, but we can't do it at the expense of also considering the impact of violence against men. I mean, I think we know that men are overwhelmingly the perpetrators of violence against men, against women, amongst children. But even if we are successful in reducing all violence against women, we are still going to have one of the highest homicide rates in the world. So it's important that we consider strategies that are going to affect men too. Obviously, there's no country in the world that's managed to stop violence only directed against women. And so we need to consider strategies at the population level. How can we improve childhood development and parenting so that children are less likely to become aggressive later on? How do we improve positive adult involvement, especially with fathers in a child's life? Controlling alcohol and guns, which are major drivers of the homicide rate, changing cultural and social norms that expect men to be aggressive and support violence between men. So these are some of the questions that we need to be asking.
And certainly, Prof, hopefully we get to have a bigger discussion about this, because, as you say, the guns that are finding their way onto the streets, we see some of them, really littering the streets, and these are some of them, illegal. And at the same time, you talk about the impact of alcohol, and so many questions there when it comes to the numbers that you've just unpacked for us. But let me thank you so much for your time, Prof, and for highlighting this very important issue. That is Professor Richard Matzopoulos, who is with the South African Medical Research Council, Burden of Disease Research.